Hey guys, it's Miss Hardy recording for Foundations of Health Science. We are moving through Unit 6. We are starting Unit 6.02 today. That's Contracts and Professional Standards. You have a note guide. It looks very similar to the ones we've done in the past, and it is due tonight. And I know that is a quick turnaround for you, but I have all sorts of faith that you will be able to get it done in time because it is quick since you are very familiar with this note-taking process. And there are a couple of quick questions at the very end of the note guide to make sure you understand the material. I'm going to share my screen with you and we are going to get started. Back out of this screen. Your discussion today is just to remind you of that assignment and then asking you about your favorite emoji. This is mine, or this one, or this one, okay? So here we go. We're going to click on Contracts and Professional Standards. We know as healthcare providers, we have a certain set of standards we must uphold and maintain because that protects us. It maintains trust with our patients, and it keeps us from being sued. And ultimately, that is the ticket, okay? So I have to go to a different screen to show it to you. So just keep in mind, you would go to modules. You would not click on files. All right, here we go. So we're going to go through this. We're going to talk about the contracts that we make and professional standards. Informed consent is the first contract we make as a healthcare provider. Informed consent, let me just make sure I'm recording. Yes, I am. Okay. Informed consent is basically your patient giving permission for you to perform whatever procedure that you were performing on them. So the person who gives informed consent must be of sound mind, which means they cannot be under the influence of any sort of drugs, alcohol, anesthesia, anything like that. They must be 18 years of age or older. Okay. The patient cannot give consent if they are under the influence of drugs, pain medication, anything like that, anesthesia, and the patient must be 18 years of age or older. Can any of you in this room give consent? No, none of you in this room can give consent. Can I give consent for myself? Absolutely, because I'm 18 years of age or older, okay? Speaking about informed consent, a couple of scenarios for you. Who gives consent for my daughter? Me or her father, okay? What happens if I'm in a car accident? Who gives consent for me? My husband does, okay? Who would have given consent for me if I wasn't married? My mom or my dad, okay? So that's kind of how it works. It can get very complicated. Can you think of a situation where it could get complicated when it comes to informed consent? Absolutely. If you're hurt and your parents and your husband do not get along, okay, your parents may fight that you want something else. So it's really important that you make your wishes very clear. That's why we encourage a living will, which we're going to talk about, okay? Another situation, what if your parents are not together and they disagree, okay? A lot of the times they make in divorce agreements, or they'll go and they'll get these documents drawn up which parent has the medical power of attorney, which means that's the person who is allowed to make the decisions, okay? Moving forward, a contract has 3 parts, okay? So there's an offer, acceptance, and consideration. The offer is when Shanora comes to my office, I'm a dentist, and Mrs. Farmer would like to be my patient. Okay, that's the offer. She agrees to be my patient. Acceptance is that I say, okay, I'd like to make an appointment at 2:30 with you. And then consideration is the payment. Okay, I've cleaned your teeth. That's going to be $10 today. We have fulfilled the rolling contract. Okay, so what you need to take from this slide are the 3 parts and then what they mean. Usually we can figure out the offer and we can figure out the acceptance, but people get really confused when we talk about consideration because that doesn't sound like it would be the money, okay, or the payment for services, but it is. So we have a couple of different types of contracts. We have an implied contract and then we have express contracts. Implied contracts are more verbal contracts. So the healthcare worker prepares medication and the patient takes it. The patient doesn't sign every single time they take the medication. It's implied that if the patient takes the medication from the nurse, they understand what the medication is, what it's used for, and they're agreeing to it. The opposite of that, and a little bit more in depth in that, is an express contract. An express contract is either oral or in writing, and it's more serious in the sense of, like, if a patient is going in for surgery and the surgery could risk their life, bleeding disorders, there's serious complications and things like that, they usually sign off. And that's where I kind of make the distinction here. Usually an implied contract is, good morning, I need to take your blood pressure, and you offer me your arm. An express contract is, good morning, I'm here to perform surgery on your colon, and I need you to sign here that I can do that. Okay, understand the two types? Okay. Moving forward. I've suddenly forgot how to use my mouse. Okay, so speaking of contracts, there are certain people who cannot enter a contract. Can you all enter a contract right now? Why? Right. Can you go buy a car? Can you go donate a kidney? Not usually, okay? Special circumstances, yes, but no, you couldn't do that without parent permission. So first is a legal disability. Any person who does not have the legal capacity. When we say capacity, we're referring to the person does not have the ability to understand the risks of what they're doing, okay? And we're speaking in a medical term here, okay? That person does not have the legal capacity or the understanding of what's being done. So even though you all are very educated, at this point you are not considered to have the legal capacity to enter a contract, but you do not have a legal disability, okay? A legal disability, and I understand it says here minors, but again, we put you in that minor category, not necessarily, you're not disabled, okay? But it's someone who's mentally incompetent, which means they have some sort of mental disability, under the influence of drugs and alcohol, or someone who's unconscious or semi-conscious. So whether that be, you know, they've gone to the hospital and been in a car accident and they've had pain medicine, or someone who is strung out on heroin, okay? Both parties have to be able to enter the contract. So when Miss Jones comes into my dental clinic, who are the parties entering the contract? Me and Miss Jones, the provider and the patient, okay? And we've already gone over this here. A 12-year-old cannot make an offer as a part of a contract. Contract law, if we enter into a contract together, whether it's an implied contract or an express contract. Implied meaning you agreed to it and you took the medicine. Express meaning you signed a piece of paper that said, yes, I would like to have this surgery. It requires that certain standards of care are performed, okay? So as a doctor, if I agree to be your doctor, then I agree to give you at least the standard of care. And if not, it's called a breach of contract, okay? That is not a very hard concept to understand. If you don't fulfill your part as the dentist and you leave her with a cavity for 6 years and her tooth rots and falls out, you have breached the contract, okay? But if you as a patient don't pay your bill, you have breached the contract. Understand? The agent is the employee. Okay, so as the dentist, I could be the employee. And so I'm the agent. The principal is the employer. So let's say I'm the dentist, but I work for someone who owns the company that I work for. They would be the principal. So think about it like schools, okay? Who's the principal here? Mr. Harris. Who's the agent? Who's the employee? Me, okay. And then we have those who we serve. Who do we serve? The students. Or in a healthcare office, it would be the patients, okay? Healthcare records, these are considered privileged communications, okay? We cannot share your healthcare record. We talked about this yesterday. If, you know, Miss Buck is my patient in my PT clinic on Mondays and Wednesdays, I can't come in and let you all know that Miss Buck is my patient, okay? If Miss Buck tells you, that's one thing because it's her business, but I can't tell you. If I saw your grandma in the hospital on Sunday when I worked, I can't come in and tell you I saw your grandma, okay? Because that would be breaking the law. Healthcare records contain confidential information. It contains your address, sometimes your social security number, and what's going on with you. So I can't share that, okay? And we, as healthcare providers, when I work in a hospital, can I read anybody's chart in the whole hospital? No, why not? I'm not assigned to them. Okay, so that's one thing you need to understand. I can access almost any chart. I can access dead people. I can access people that have been discharged. I can see every single name in the whole hospital if I want to, but I can't just go opening charts to see what's interesting. This comes into play a lot of the times if there's like a big accident that happens and everybody knows about the patient, or there's a celebrity, people want to click into the charts. You cannot do that. Okay, but you are entitled to read and review records of anybody you are assigned to work with. Okay. So when it comes to medical records, a lot of the times they're digital. Okay, so a lot of the times what you're doing is on the computer. Now, the last place I worked, it was handwritten notes. Okay, biggest thing you need to understand, okay, especially when you get out of my class and you get into like Health Science 2, where we practice writing notes in patients' charts. And then if you want to take our Nursing Fundamentals class here, you do not write in pencil. You do not write in a pink gel glitter pen, okay? If you are writing in a patient's chart, it has to be in black ink, okay? The reason that it's in black ink is because you can't erase it, and because if we have to copy that chart for any reason, it will copy over. If you make a mistake in a patient's chart, okay, what you're going to do is, and we'll read the chart, read right here, and I'm going to give you an example on a sticky note. You're going to make a single line through it. Let's say I meant to write right side, and I write left side, okay? So I'm just going to say patient complained of left pain, okay? Left arm pain. Let me start over because Miss Hardy don't know how to spell this morning. So remember, we're going back to our medical terminology because that will never leave us now, okay? Patient complained of left arm pain, and I meant to write right, okay? We're going to read this slide here. It says, do not erase the mistakes. So I'm not going to go through it. I'm not going to scribble it out like this, okay? I'm not going to scribble it out. I'm not going to go like this, okay? Because that is not professional, okay? What you're going to do is make one strike through it, one straight line strike through the left, okay? You're going to write what you meant to write up there, and then you're going to initial it, and you're going to date it, okay? Some places require that you put doc error so that people know that you did it wrong, okay? And I know this is backwards for y'all, and I can write this bigger, but I put one line through it, SDH, those are my initials, and then I wrote the date so that they know it's incorrect, okay? You have to do this. You will practice. How many of you want to go to nursing school or surgery or something like that? You will practice this over and over and over, okay? So you will know this. Do not erase. Records, how do we keep them safe, okay? Well, most of the time they're on the computer, all right? But if they're not on the computer, okay, they have to be stored in a locked, secure area for a certain amount of time. So, of course, Vidant has huge computers that store all of your information. But there was a time when Vidant kept written records, and they still do keep a written chart on you in case the computer system were to go down. And they have to maintain that. So it's stored in a locked, secure area. And then if you have computer access at Vidant, how many of you have seen the Vidant badges? Okay, we use our badge now to scan in and out of the system, so that keeps it safe. So when I'm finished at a computer, I don't have to worry about clicking log out. I scan my badge and I walk away. Okay. Records must be either shredded or burned. I've not seen records be burned in a very long time, but even when I walk out of work on a Sunday, I throw my paper that I keep all my patient information on in a shredder, okay? And they shred that information because you wouldn't want that released to the public. You wouldn't want to throw it in a regular trash can, okay? So why do we do this? HIPAA. Everybody say HIPAA. If I give you a clue, most of the time I'm going to say hippopotamus, okay? HIPAA is Health Insurance Portability and Accountability Act. You have to know HIPAA, you have to know what it means, and you have to know what it stands for, okay? And most people get this wrong. Most people will do HIPPA, and they'll get it wrong, okay? So you need to understand that it's hippopotamus, okay? So HIPAA. It was a federal government law. So that what's federal mean? Is federal just North Carolina? Federal is everybody, okay? And basically it's the standard of how we protect your information, okay? So there are a couple of standards here, okay? You will have to write these in your notes. I'm not going to read them all to you, but basically if you want to see your healthcare record, you get to see it because you're the patient. If you want to know what your healthcare provider does with your information, you get to know that. If you want to limit what happens to your information, you get to do that. They have to communicate with you, okay? You have to be told how to file a complaint if you disagree with the information in the computer, and you have the right to say who has medical access. Now, right now, y'all don't have many rights as patients because y'all are underage. It's your parents making the decision for you. And in most cases, parents make the decision based on what's best for the child. Are there going to be instances in your career where the child does not want, let's say you have a terminally ill cancer patient who doesn't want any more treatment, but the parents do, okay? What do you think they do? If you have a 15-year-old who understands if I don't have treatment anymore, I'm going to die, and you have parents who want to continue treatment that's painful and expensive and is only going to prolong the inevitable, you're in an ethical dilemma, okay? So at that point, they would call in people to help make decisions because we have two parties that are disagreeing, okay? But once you hit 18, you have full say-so over your right, okay? Your parent can come in there at 18 all they want to, okay? There are still certain things that cannot be shared with your family as a patient, okay? So if you come into the clinic and you are asking about sexual health and birth control, it can't be shared, okay? Because you... Sticky situation here, technically no, because those are one of those protected health informations, because a lot of the times, even at this age, when they do full physicals of a child, at this age, they'll have the parents step out, because ultimately, if you are active in that lifestyle, then they would want to make sure you understand the risk and benefit of it and encourage you to obviously practice safe practices. So that is a very gray area when it comes to healthcare. We'd rather treat you and educate you, even if that means, you know what I'm saying. All right, so principles vary from state to state. Again, you have to learn the standard based on which state you're in. And these are the professional standards, okay? As a professional, as a healthcare provider, okay, I'm only allowed to do what I was trained to do, okay? As a healthcare provider, I have to use the correct method. I cannot make up my own way to take your blood pressure. I cannot wrap a blood pressure cuff around your neck because I think that's the right thing to do, okay? I have to do what they tell me to do, okay? I have to make sure that I have the proper authorization before I do something. I cannot go stick a needle in your eyeball just because I want to. I have to make sure that your parents understand the risks, okay? I have to make sure that you are the patient I was supposed to be working on. So when I walk into a room, I ask the patient their name, I look at their ID band, and then I make sure I'm in the right room, because I do not want to be doing exercises on Miss Jackson when I was supposed to be working with Miss Carter, okay? Observing safety precautions, okay? I don't want you walking around in PT with a set of stilettos on, okay? I don't want you walking around in PT if you're not supposed to be putting weight on your right leg. I'm supposed to keep all of your information confidential. I do not care if you have HIV, gonorrhea, syphilis of the eyeballs, genital herpes, and a bad leg, okay? I cannot share that information, all right? Think before you speak and carefully consider every single thing you say. I cannot stress this to you enough. Even if you think you are responding the correct way, even as a teacher, I very carefully choose how I answer questions, okay? Because you never know where that information is going to go. You never know if you say something to a patient, if it will offend them, and they're going to call the hotline and say that Stacy Hardy, physical therapist assistant, came into my room today and made racist remarks. You could lose your job, lose your license, and ruin your professional reputation. treating all patients equally, regardless of race, religion, social, economic status, sex, or nationality. I remember when I was a high school student, I was on the thicker side, honey. Okay, I have always lived the thick life. Okay, and I had a patient who called me fat in front of another physical therapist. Okay, and you know what I did? We redirected the conversation and we continued because I'm a professional. And ultimately, my job was not to please him with my physical appearance. My job was to treat him. Okay, keep that in mind. Patients are going to say things, especially in my experience. Older patients will say things. Another thing I get a lot, not as much now because I am older, but when I first started doing this, I was literally 17 years old. Are you even old enough to be here? And I had patients who requested not to work with me because they didn't think I was old enough. You have to treat your patients the same, no matter what they say, no matter what they do, no matter what they look like. Okay? Now, if a patient starts verbally abusing you and calling you names, as I have seen happen, I have had patients who absolutely refuse to work with certain races of nurses on floors that I was on. Okay? You do not have to work with that patient. We can get another nurse in there because you cannot perform your job to a full duty if you're being verbally abused by a patient because of your race and nationality. So remember, we have to take care of you so you can take care of the patient. And then, of course, you cannot accept tips or bribes for the care that you provide. Okay, so you cannot accept a gift from a patient. Now, do patients sometimes provide breakfast for the entire floor? Sure. Do they sometimes leave a gift card or something like that? Sometimes. Okay, what you cannot do is, my dad, he really needs to get out of here by 4 o'clock today. Is there any way you can move him up on the patient caseload? Here's a 20 for your trouble. You cannot accept that. Okay. Behave professionally in your dress, language, manners, and actions. Remember that you're professional. It's so funny to me they put these two people up here. Okay, where's our nurses and doctors at? Because we don't wear this to work. Okay, you must present yourself as a professional always. Okay, so I understand, like, we've all seen the nurses who look like they rolled out of bed with their scrubs on, and we've all seen the teachers who sometimes roll out of bed to come to work. Okay, but as a professional, there are certain things you can do that make it look like you're ready for your day. Same thing as a student. And of course, if you make any errors, report it. We would rather treat your errors and take care of it beforehand than kind of catch you trying to cover it up. Okay? That was a lot of information, but it was really good information. What questions, comments, or concerns do you have? Okay, so you have your assignment that's due tonight by 11:59, so you will have the rest of class today to work on that. If you have questions, comments, or concerns, please let me know. I am here to assist you all day, and it has been my pleasure serving you today.